President speaking just about an hour or so ago. Now, police say the number of gender-based violence cases has increased drastically during the lockdown. The Solidarity Fund is going to inject cash to help victims. 17 million rand will be allocated to the National Shelter Movement. The non-profit organisation supports a network of 78 shelters across South Africa and also Tutuzela Care Centres, a government initiative aimed at ensuring justice for victims, also the Gender-Based Violence Command Centre. Well, for more on this, I'm joined by Wendy Clow from the fund. Wendy, good evening, and thank you very much for joining us this evening. This 17 million rand will be distributed, as I've just mentioned, but exactly how is the money going to be spent? Is it going to be spent on hiring new staff, people who can help women with counselling or rape kits? Exactly how will the money be used?
The three different organizations have got different interventions that they'll be using the money for. So, for example, the Gender-Based Violence Command Centre will be using the funds for resources such as social workers and supervisors that will help in the call centre, so as to alleviate with the calls that are coming in and the messages that are coming in. And then secondly, they'll be using the funds to get tools of trade to enable the call centre to be to manage the influx of calls and messages. With the National Shelter Movement, we actually had a mad meeting with them this morning, and they have expressed to us that they would like to use the funds to help with medical services, so getting medical kits for victims, making sure that victims and women and children have got access to counselling services, to psychiatric services, but also things like making sure that their staff and the victims actually have transport to get to the actual centres and to the actual shelters. The Tutuzela Care Centres, on the other hand, had expressed to us that they were looking to spend the funds on PPE as well as equipment such as rape kits. So there's quite a different need across the different organizations that will be funding in order for them to respond effectively to the upsurge that we've seen in the cases of gender-based violence during this time of the pandemic.
Yes, and of course it was flagged right from the start, concern that women in abusive relationships would not be easily able to escape their homes due to the lockdown. But has the impact of the lockdown on GBV been much worse than the Solidarity Fund anticipated?
We did a rapid assessment at the beginning of the hard lockdown, and what that told us was that there was almost double the number of calls that were going to the command center, and almost 10 times the number of messages that were being fielded by the command center. We also obviously heard from the Minister of Police as well as the President that police had been dealing with numerous counts of cases of women and children that had called on police stations across the country seeking help where they could escape. And go and look for help. So yes, just based on that rapid assessment that we did, there was definitely an upsurge in the numbers. There was definitely also another effect in that the lockdown had the unintended impact of some of these centres not being able to access permits in order for them to actually deliver the services that they're supposed to deliver. And even though we've seen the easing of the lockdown, we still have these women and children still under these conditions of being at home with these people who abuse them and these men who abuse them in particular. So whilst the lockdown has eased, the cases still haven't seen a decrease.
You said you were speaking to people who run these shelters this morning. Have they indicated whether the unbanning of the sale of alcohol, which came into effect since 1 June, has had an impact as well?
Our conversations were really centered around how we disperse the 17 million rand, how we do it immediately, how we do it within the governance structures that we have, as rapidly as possible so that it reaches the victims as quickly as possible. We didn't have time to really go into any other sort of impacts of the lockdown outside of what we had discussed with them during the time when we did the rapid assessment. And obviously now, as we talk to them, whilst we try and prepare to get into agreements, MOUs and contracts so that we can actually disperse the funds so that these services can be received.
GBV sadly was with us before the lockdown, and it will be with us even when the lockdown goes away, whenever it does go away. How long can you continue to fund? Is it a once-off 17 million, or would you look at providing further funds down the line?
So this is the first funding that we are doing as the Solidarity Fund, and it's really in responding as per our mandate, that we are responding immediately in the short term to fill the gaps that are experienced by the most vulnerable in our society, especially when it comes to gender-based violence and to issues like food relief. However, we do intend to have a second round of support. That round, though, we intend to be much more sustainable. We intend it to be an injection into interventions that are at a system level that will be catalytic so that they actually have a legacy way beyond the lifespan of the fund.
Well, thank you very much for your time this evening. That's Wendy Clow from the Solidarity Fund.